As of next week, lower-priced generic versions of the drug Ozempic can be made by drug companies in Canada. At the end of December, Health Canada received 9 submissions seeking approval to make semaglutide, which is the active ingredient in brand-name diabetes and weight loss drugs like Ozempic and Wegovy. Based on pricing models in Canada, generic versions of drugs like these could be priced at as much as 35% of what current brand name offerings cost. That could result in significant savings for Canadians using name brands like Ozempic, which can cost a few $100s a month. With me now is Dr. Sue Pedersen, endocrinologist and obesity medicine specialist. Doctor, thank you very much for being here. I want to start by asking, what does this all mean for patients who are either looking to manage diabetes or lose weight?
Well, thanks so much for having me this morning, Renee. It's a really exciting time for Canada. We're actually one of the first countries to have a GLP-based medication, semaglutide, become approved as generic medication in Canada. And what it's going to mean is that the medication is going to become cheaper for a lot of people who currently can't afford to pay for the brand name Ozempic, which is for diabetes, or Wegovy, which is for weight loss.
Will generic Ozempic or Wegovy work the same as the brand name version?
Yeah, so Health Canada approves generic medication if they're satisfied that they have similar effectiveness and safety as the brand name. So yeah, it should work similarly to the brand. That said, we do see when generics become available with a history of many other drugs in Canada, sometimes people don't respond as well to generic versions. So it can be discussed on a case-by-case basis whether to go with generic or with brand name.
Now, do you expect the costs to drop right away for patients?
Yeah, we do. So as soon as the generic medications become available in pharmacies, we do expect that they will be cheaper immediately. Now, how cheap? We don't know. There's a lot of hush-hush, it seems, about the generic medications and which companies and approvals and prices. So we really don't know how much cheaper. So there's lots of rumors going around, but we really won't know until it's available in pharmacies. The other thing is that we don't know how the dosing is going to work. So some people who use the prescribed Ozempic or Wegovy use a counting clicks, and anyone who's using those pens out there is going to know exactly what I mean by counting clicks. Sometimes this is done to cut costs. Sometimes this is because people only tolerate a certain dose, so they only click partway up on the Ozempic or Wegovy pen. So we don't know yet what form factors these generics are going to be in and whether they will allow people to click count or not.
These types of drugs have sort of taken the world by storm, especially you see on social media, celebrities using them for weight loss. With this newest development of a generic Wegovy or Ozempic, do you expect to see an increase of these types of drugs being prescribed?
Yeah, I sure do. And it's wonderful because it makes GLP-1 based medication available at a cheaper price for so many people who couldn't afford to pay for the brand name. So we still have 1 in 3 Canadian adults living with obesity. And if you look at overweight and obesity together, 2 out of 3 Canadian adults fall in that group. So we still have a long way to go to have more access to treatment in general. And it's not just about obesity medication, but also lifestyle change support, psychological support, and access to bariatric surgery as well.
All right. Thank you very much, Doctor, for being here. Appreciate your time today.